Hello friends, I am Dr. Darshan Dave and today we will discuss about the certain definitions in the general pharmacology, and the learning objectives of the today's sessions are: what is pharmacology, what it encompasses, which parameters or the which parts that are discussed under the pharmacology. Then, what is the basic difference between pharmacology and pharmacy? Then, we will discuss, as I have told in my first sentence, that basic terminologies of the pharmacology, and these are: what is drug, pharmacodynamics, pharmacokinetics, experimental pharmacology, clinical pharmacology, pharmacotherapeutics, and lastly adverse drug reaction. So we'll discuss one by one. First, what is pharmacology? If you just break this word pharmacology, it is made up of two words, that is pharmakon and logos. And as you know that for majority of the medical terms, they are derived from the Greek terminology, and the meaning of this pharmakons is the drug, and logos means to discourse in or to treatise, or in a simple way to detail study. So pharmacology means the study of the drugs. Okay, in a very simple language, if someone asks you what is pharmacology, pharmacology means study of drugs. But if you just go further, which parameters to be studied, and these are the study of from where the drug is obtained, sources of the drugs, then what are the physical and chemical properties, characteristics of the drugs, structure activity relationship, then what is the effect of the drug on the living organism, on the biological system, and what happens to the drug once it enters into the living organism, like the drug that is going to be absorbed, distributed, metabolized, excreted. All this will be discussed in the pharmacology, and why we are using the drug for some treatment of the disease. So the therapeutic uses of the drugs and their dosage regime, their indications, contraindications, drug interactions, and adverse drug reaction. So all this will be studied in a pharmacology. Study of all these parameters of the drug are included in pharmacology. Now, can we say that in a one sentence, if you want to describe that what the ultimate purpose of study the pharmacology, the purpose is to use the detailed knowledge of the drug, its action on the human system, to get the maximum benefit of the drug for the treatment of the particular disease with the minimal adverse effects. So pharmacology, you can say that it is a therapeutic implications of the knowledge of the drug, and the better way it is also called as a clinical pharmacology. So now, how the pharmacology differs from the pharmacy? You already know that from the previous two slides what is pharmacology. But what is pharmacy? Pharmacy means it is a science of compounding and dispensing the drugs. Okay, all the steps, I will not go into the detail, but starts from the identification, standardization, compounding, and ultimately to prepare the drug in a suitable dosage form that the patient or the individual can take. Okay, and that will enter into the pharmacy. Now there is another term. Now don't confuse with the clinical pharmacy and pharmacology. So pharmacy, you have understood the compounding and dispensing of the drugs and preparation of a suitable dosage form. Now the clinical pharmacy, it means that guidance by the pharmacist to the patient regarding how to take the drug, when to take the drug, what precautions should be taken. So all this guidance and instruction by the pharmacist to the patient regarding the optimal usage of the drug, it will come under the branch of clinical pharmacy. Okay. Now the next is the drug. Now here the word drug, it's come from drug, that is French word, and it's known as a dry herb. But to understand what is drug, obviously the drug is a chemical substance, and that chemical substance which can modify or explore our biological system, so that is physiological system, or in the disease state, the pathological state. So drug is a chemical substance which modify or explore the physiological system or the pathological state. But for any agent, you just think that any chemical agent, if it modify or explore the physiological system or the pathological state, can we call it as a drug? Something is missing, and that is all that modification or the exploration, but that is for the benefit of the recipient. So drug is any chemical substance which can modify or explore the physiological system or the pathological state for the benefit of the recipient. So dear friends, always while learning the definitions, don't just simply mug it up. Try to understand that why that particular phrases are there in the definition. Okay? So then it will be easy and it will serve the purpose of the definition remembrance. Fine. Now what is pharmacodynamics? Now here again you can see that the pharmacodynamics is made up of a two term, that is pharmaco and dynamics. Now what is the meaning of dynamics? Many times we are telling that it's a dynamic personality. So dynamics means power, it means the action. Okay. So pharmacodynamics means what is the action of the drug on the obviously living organism. So we can say that pharmacodynamics means it is the effect of the drug on the biological system. And what it includes? All the biological and physiological effects of the drugs on the living organism. Then the drugs produces the action, but at which site? The site of the drug action, the mechanism of the drug action, how the drug produces the action. Now dear friends, there are two terms that will come in the pharmacology. One is the mechanism of action of drug, and second is the pharmacological actions of the drug. Pharmacological actions means what the action that the drug produces on the living organism, and the mechanism of action, it means how the drug produces that pharmacological action. Say for example, salbutamol, which is used in the treatment of bronchial asthma. So the pharmacological action of the salbutamol is bronchodilation. Okay, and that is helpful in the bronchial asthma. So the pharmacological action is bronchodilation. And how the salbutamol causes bronchodilation? Through the receptor or through any other means. What is the mechanism? That is come under the heading of mechanism of action. So don't confuse with these two terms. Okay. Then yes, very important that you all know that the drug is given at a particular dose. Okay. So the dose response relationship, it will again studied in detail in the pharmacodynamics and The last but the very important point of the pharmacodynamics is factors modifying drug action. You all know that for a same disease, say for example, if the two individuals who are having a hypertension and the blood pressure is same, say for example 150 by 90 millimeter of mercury, and if you are giving the same drug in a same dose by same route to the two individuals, even though there are these many similarities in the person as well as in the disease, but still the response rate is different. It means that there are many factors here. Even if we have taken the majority of the similar factors, but still the response is different, it means that there are many factors which can modify the action of a drug. So all these parameters will come under the pharmacodynamics. And if we want to say in a very simple term, then pharmacodynamics, it means that what the drug does to the body. Next is pharmacokinetics. Here again, if you look this word carefully, it is made up of a two term, that is pharmaco and kinetics. Kinetics means you all know it is a movement. So can we say that pharmacokinetic is the movement of the drug? Yes, but still to refine it, pharmacokinetics is a movement of the drug inside the body and alteration of the drug throughout the body during these movements. So it is a study of the movement and alteration of drug inside the body, and it includes as we are taking the drug by any of the route, but ultimately it has to enter into the systemic circulation, and that is known as an absorption. Once the drug is absorbed, then it enters into the circulatory system and it reaches to the target site. Now once it reaches to the target site, then it produces the action. That part comes under the heading of pharmacodynamics. Now once the drug produces its desired action, there are two possibilities. Either the drug enters into the liver and it is metabolized, and after that it is eliminated by the kidney, or the drug is primarily eliminated unchanged by the kidney. So in short, again, if we want to tell pharmacokinetics in a very simple way, it means that what the body does to the drug, and that is exactly opposite to that of pharmacodynamics. Pharmacodynamics means what the drug does to the body. It means the actions of the drug on the biological system, while the pharmacokinetics means what the body does to the drug. It means that the absorption, distribution, metabolism and elimination of the drug. That if any drug is discovered, uh, or if you find that the drug is having some promising pharmacological actions for a particular disease, but it must be tested first in the animals, and that is known as an experimental pharmacology, study of the drugs in the animals. These are also known as the preclinical studies. There are certain studies carried out regarding obviously the pharmacodynamics and pharmacokinetic studies, then acute toxicity studies, subacute and chronic toxicity studies. And here the purpose is to know that whether the drug is effective in the animal, that is one, and second, a significant amount, okay, hundreds and thousand folds of the drugs are given in the animal, and to check for the safety data, because the safety is the primary concern. And if the drug passes through all these phases successfully, then the study of the drug will be conducted in the human being. Okay, but in short, experimental pharmacology means study of the drugs in the animals. Then clinical pharmacology, as I told you, once the drug passes successfully from the experimental pharmacology, then the drug will be studied in the human being. Okay, and there are the study of the drug in the human being, that is known as a clinical pharmacology. But what it includes? Obviously, it includes the various phases of clinical trials. Like first the drug is studied in the healthy human volunteers, then few numbers of the patients, then a more number of the patients, and finally the drug is approved. So these phases of the clinical trials that we will discuss later in the subsequent lectures. But there is a one misbelief that only the study of the phases of the clinical trial will come under the clinical pharmacology. No, these clinical trials, it will definitely come under the heading of clinical pharmacology, but there are many more things that are come under the heading of clinical pharmacology, and these are the establishment of the, as I told you, the establishment of the safety and the effectiveness of the drug through the clinical trial, and then ultimate aim of the clinical pharmacology is to maximize the usefulness of the drug and minimization of the adverse drug reaction through the knowledge of the pharmacology, and this can be possible with the help of individualization of the drug therapy. Individualization of the drug therapy means consider the individual factor. Suppose for two patients is having a bronchial asthma, for one patient because of certain reasons or the factors, the selection of the drug is different. For another patient, the selection of the drug is different. Again, if the selection of the drug is same but the dose is different or the route is different, so all these will come under the clinical pharmacology. Okay. So again, if you want to say in a single sentence, clinical pharmacology means all the study of the drug in the human being with the purpose of optimal usage of the drug, that is known as a clinical pharmacology. And what do you mean by optimal usage? We have to maximize the benefit, we have to minimize the harm, and this can be possible with the help of individualization of drug therapy. Now, the last is the adverse drug reaction. There is one very good sentence that any drug can produce some action and it can be used in the therapeutics only and only if it is having some adverse effect also. And you all know that whenever you are taking a drug, there are certain unwanted effects that you don't know but you have to bear. So what is adverse drug reaction? Any noxious and unintended, you have not intended that response. A common example is, suppose you are taking any analgesic drug for the relief of the headache, you don't want any other action other than the pain relief, but unfortunately you get a gastric irritancy, peptic ulcer, so that action you don't want. So any noxious and unintended response to the drug, and yes, obviously at the therapeutic dose, because any drug, although I can say that any substance if you take it in a higher amount, it will definitely produce some adverse effect. Okay. So adverse drug reaction means any response to a drug which is noxious and unintended and it is at a therapeutic dose. Okay. So now next is therapeutics. Now actually this word therapeutics, it is come under the branch of medicine. And what is the meaning of the therapeutics? It means that the treatment of the disease or the prevention of the disease, that comes under the heading of therapeutics. And many a times the relief of the symptoms, or in a certain cases like in the cancer, we are just doing the palliation of the symptoms. It means that we are just producing the relief of the significant symptoms. So now all these is known as a therapeutics. Okay. And then what is pharmacotherapeutics? When all the purpose, if we serve with the use of the drug, then it is called pharmacotherapeutics. Okay. So this is all about the basic terminologies, and if yet you have not subscribed to the channel, that is Pharmacology in Simplified Way by Dr. Darshan Dave, please subscribe it. Keep sharing and keep learning. Thanks a lot.